Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Hi there, Dr. Darrow.
Hello, Nita Valens. How are you today?
I'm great. And yourself?
Well, you know how I'm doing. I'm living it up, always.
Yay. I just always have to hear you say it, though.
It makes a smile on my face. How about yours?
And mine, too.
Good.
I love it. Well, we want our listeners to smile and feel good. So with that, we're going to have the phones open here at the station all hour long for your calls at 866-870-5752. That's 866-870-5752. And if you're new to the show, our topic is musculoskeletal pain. That means pain in your joints, muscles, tendons, ligaments, disc, back pain, neck pain, knee pain, hip pain, arthritis pain. It could be stiff joints, dull aches. Orthopedics basically is what we're talking about. And when you call the program today, you get Dr. Darrow's latest book for free called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. So listen up if you haven't heard this before. Very important stuff we're going to talk about today.
Aren't we giving out free books?
Yeah, I just said it's free. It's absolutely free.
I want people to hear that.
Yes. Free, free, free. There's not much free in this life anymore,
I'm actually
right?
holding up a copy of the book right now to the video camera.
That's awesome.
And this book is amazing. It took me 5 years to put together. I did it to gather research for the people that are more on the analytical side. And it's got a lot of photographs of me doing injections. And also a good place to watch me actually do them live is on our website at www.lastemcells.com. That's www.lastemcells.com. And you can actually see me doing the procedures with PRP, that's platelets, which are spun out of your blood, or with bone marrow, which is taken from your back, actually not the spine, but the pelvis. And both these procedures are amazing. I've been healing myself for over 20 years using regenerative medicine. And when you're finished, Nita, I'm going to tell the story about my knee, which occurred recently. You let me know when you're ready.
Okay. Well, just a reminder, we were just talking about that you'll get a free book when you call the show today at 866-870-5752 here at this station to speak with Dr. Darrow. And there's a website you can go to and get tons of information at www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and see him performing the treatments on videos. And perhaps you've been listening for a long time and you know that you need to make an appointment to see Dr. Darrow in person. You can just call the office anytime during the show or after. That number is 800-300-9300. That's 800-300-9300. And you're on.
All right. So last week I was telling the story about my right knee. As a lot of you know from years ago, my husky Dakota ran into my left knee at the dog park. He's about 80 pounds, full speed, and opened up the MCL and the stretched out the, or we call attenuated the cruciate ligament, the anterior cruciate ligament, the ACL, and the medial meniscus all at once. He's very crafty at that. And I was able to heal my knee. It was the patella, the round bone in the front, was getting stuck in the trochlear groove. That's a groove in the femur that it slides in. And it was tough straightening it. It was catch. And I did one PRP on it, and it tightened right up. It was one of the most miraculous experiences of my life. So I'd tried other things before that, and it helped, but it didn't do it. But the PRP, which is called platelet-rich plasma, which is a process where you draw your blood, actually we draw your blood from your arm, and we spin it in a centrifuge, and then we throw away the red cells because they can inflame the area, and I'll tell a story about that soon too. But I put the platelets in, and the very next morning I awakened, and the knee was strong, pain-free, and I was able to go sprinting again. And then about 2 weeks ago, my right knee, which had been hurting for a while, but of course I never pay attention to pain. You guys don't either, do you? Anybody out there pay attention to their pain? Nah, we just keep going. Yeah, I don't hear anybody yelling.
I'm not answering.
When I told the story to someone, they said, yeah, anything worth doing well is worth overdoing. And I laughed at that. And that was one of these stories. My knee on and off was hurting a little bit. And I think way back when I did a PRP on it. And then I think I did a stem cell on it, and that healed it up. And then during the COVID period, I was having to walk on golf courses because we weren't able to use carts. And the course that I play at, which is Mountain Gate, is extremely mountainous. That's why it's called Mountain Gate. And I was hiking up and down the mountains, and my knee was really hurting. But of course, I was so happy to be playing golf, I didn't stop. And every Saturday and Sunday afternoon, I'd be getting out there and making it worse, and I didn't care. And then I'd run a few times a week, and it was hurting more and more. And of course, I didn't pay attention. And then my final and last golf game a couple Sundays ago, it really hurt. It hurt so bad I went over to the office and I aspirated, that means drew out, about 35 cc's of, thank goodness it was nice yellow clear fluid, which is synovial fluid. Just means that I'd really irritated it. And I put in some platelets and stem cells, and then it blew up again the next day. And then the following day I just aspirated again, a little less fluid. I think it might have been down to 30 cc's or so. And then I put some stem cells in, and then a couple days later did the same thing. And my knee now is about, I don't know, probably about 80% better. And I'm being very smart this time. I still think there's a little fluid in it. I looked with the ultrasound the other day, and I saw some fluid there, so I'm waiting to get it dried out before I play golf again. And there's a lot of information in this story, which is just aspirating your knee or some other part of the body is not good enough. You've got to treat it. And people come to me all the time and they go, would you just aspirate that fluid out? My knee is hurting. It's stiff. And I go, no, I won't. And they get mad at me, and I go, you got to treat it, because if you just take the fluid out, it's going to come back in almost every case. Unless sometimes, let's say you blow out your ACL and there's blood in there, that's good to get out immediately. You don't want to wait. And I don't know why doctors wait and leave it in there. You want to get it out. That the blood that stays in a joint is very caustic to the cartilage. It's not good for it. And it's good to just aspirate it out so you don't have a blood clot in there, hematoma. So thank God that didn't happen to me. I didn't tear anything, because had I torn my ACL or ripped a meniscus, there would have been blood in there. When you have an ACL tear, that ligament is very vascular and it bleeds up and fills up with blood right away. Like within an hour you're going to see it. If it's a meniscal tear, then it may happen overnight. There's not as much bleeding that takes place. So I'm very happy with my results with my knee so far. It's not 100%. I'm not ready to go running or golf yet, but hopefully by next weekend I'll have better news for you on the show. and I'll be ready for action. And, typically, had I gone to an orthopedic surgeon friend of mine, they would have said, we need to operate. And I would have said, well, I'm not going to do it, because I've been through this over and over for 22 years or so of working on my own body, where my friends have said, you need to operate. And I've never done it. But for the first time, when I'm going to call myself a dummy, when I was in medical school and hurt my shoulder and had a shoulder surgery that I never should have happened. I never should have done it, but I didn't know better then. I didn't know about regenerative medicine. And that shoulder, as my right shoulder got very, very swollen, the whole arm was swollen. It looked like a water balloon, and I had a fever from it, and it's a surgery I wish I'd never done, but the good news in it was I learned not to do surgery. I was in training to do surgery at the time. I was going to be an orthopedic surgeon. And after that, I switched horses midstream and got my board certification in physical medicine rehabilitation, which is really part of it is saving people from having surgery. And in the last 22 years, there have been thousands and thousands of people that have come to me ready for surgery, and they never had to have it. And this is not a negative statement about surgeons. I always have to say that. I love surgeons. The work in surgery is very difficult, and I'm not going to say dangerous, but there's a lot of side effects for the patient. And one of them is what happened to me with my surgery on my shoulder, which was, it went bad, and I had a fever. I thought it was an infection. Thank goodness it wasn't. And I was able to heal that surgery just using regenerative medicine, heal my own shoulder. It's a funny story. Anita, you know it, and some of you people that are listening who have known me for years know the story. I had my wrist done at a convention, national convention, and the wrist healed 50% overnight. And then I was like, hey, maybe I should do my shoulder. So I hopped in bed with my wife, who was watching TV, and I pulled out a syringe, and she started swearing at me, like, what the heck do you think you're doing? And I injected my shoulder right there. I said, I'm trying something new. It worked on my wrist. And I woke up the next morning, about 12 hours later, my shoulder was completely healed. I had no pain. I had full range of motion, and it lasted 12 years until I re-injured it. And then I shot it up again, took 2 times, and the shoulder was good for many, many years until another injury. And yeah, I may injure my shoulder again. I mean, I'm pretty ballistic with sports, and as you've just heard, when it starts hurting, I don't quit. And that time it took a longer period of time to heal, and I used platelets on it and stem cells, and it's healed up. It's perfect now. The guys watching in the video, you can see I'm waving to you, so the shoulder is great. Another part of the story for that shoulder is it does have a couple of rotator cuff tears. It's got a subscapularis tear here from weightlifting injury years ago, and a supraspinatus tear here. And in the back, it's got a tear of the labrum, which is sort of a lip that goes around the humerus bone, the arm bone. But I have zero pain, and hopefully the shoulder is going to last me a lifetime without having to inject it again. If I listen to my own doctor's orders, which is when it starts hurting, chill, let it, give it a break. And I'm going to give out our phone number to the studio right now so we can get some callers. And that is 866-870-5752. I'm going to say it again, 866-870-5752. Please call me. I would love to talk about you. I've got a lot of questions here, but it's much more fun to talk to people live. And I'm going to give out the office number next. If you want to get more personalized attention about your symptoms, if you're shy to call the radio show. And the office number is 800-300-9300, and there's people by the phones all the time. You can call right now. And I want to talk about one other thing that I don't want to forget about, which is the vampire facelift, which we do in the office. We use the same thing. We can use platelets from your blood, or we can use stem cells and inject them into your face and regrow the collagen in the face. So when I'm working on your tendons and ligaments and your joints, that's all I'm doing, is I'm regrowing and re-stimulating new tissue to grow and rejuvenate the joints and the tendons and ligaments. It's great for back pain and neck pain and every joint in the body. I do toes and fingers and shoulders and elbows and wrists and hips and knees and ankles, you name it. I inject everything on the body. And a lot of people get something that is considered kind of unusual, but a lot of people get it. It's called tsetse syndrome. And what it is the interfacing in the ribs gets sprained. And it's also called costochondritis. And I get a lot of people where I have to inject the ribs in their back or in their chest, especially after people have had their chest cracks. For a bypass surgery, which isn't happening as much anymore. They're doing stents. But I used to get tons of people that would come in, they'd have that midline scar where the chest was cracked, but then after they heal up and their heart is better, they have this lifelong pain, which we get rid of by just using platelets and stem cells. We had a golfer, I won't say his name. Actually, I bet he'd like me to say his name. His name is Alex Romo. I hope you're listening, Alex. I follow you on Facebook. And he's a pro golfer. And he came in with rib pain in the front of his chest where it attaches to the sternum. And his career had been over for a while. And then we were able to inject that several times. It's a dangerous area to do surgery on because the aorta is right underneath it. So yeah, we did platelets and stem cells there, and I watch him hitting balls all the time on Facebook, and he smacks it pretty hard. His swing speed is probably 120 miles an hour, if not more. So you can imagine that he's doing pretty good. He has no more pain there. So these are things, these regenerative medicine procedures are pretty amazing. It's not going to work on everybody, but it's worked on me and it's worked on thousands of patients. And certainly before you would consider surgery, I think you owe it to yourself to consider doing this. And what do you got to say, Nita? I'll give you a chance.
Oh, well, it's so interesting. I'm listening, but I want callers right here at the station. So this is your golden opportunity to speak with Dr. Darrow at 866-870-5752. That's 866-870-5752. Reminding you we're here Saturdays at 10 a.m. and again at 1 p.m. and other times around the dial. So if you're hearing us not at one of those times, you can call the office for more information 24/7. That number's 800-300-9300. That's 800-300-9300. And the website, if you haven't checked it out, is www.lastemcells.com. That's lastemcells.com.
Also, my book that I'm holding up in front of the video is called Stem Cell and Platelet Therapy. And then the byline is Regenerate, Don't Operate. That means grow the tissue back, regenerate the area, rejuvenate yourself. Do not operate unless you have to, because these operations are fraught with side effects, infections. Sometimes, I'm like my own body, which I talked about. I had a terrible, terrible aftermath from a shoulder surgery that took years to heal. And this book is amazing. It's got 264 studies in it on why you should not do surgery and why you should just regenerate the body with injections. It's easy. You walk in, you walk out. These are free. Give us a call. You'll get one for free. And there is a wonderful foreword by my favorite woman, other than my wife, Suzanne Summers. And Suzanne, thank you so much for writing it. And also, she has a new book that I'm showing to the video guys. It's called A New Way to Age. And on page 302, there's a chapter about me. Dr. Marc Darrow, and it's about regenerative medicine. So this is an amazing, amazing book. Suzanne Summers, thank you so much for everything you do for us doctors. And you're like the Galileo of medicine, saying the world is not flat. And, he was inquisitive way back when, whatever century that was, because he said the world is round. And we are changing the face of medicine. We're moving to things that are not as invasive. And regenerative medicine is one of those. I've been riding the white horse of saving people from surgery for over 22 years. And now the country is full of doctors who do this. And I was not one of the first, but one of the guys who brought it out to the public. And I feel very good about my life as a doctor and my career as a doctor to save people from surgery. And again, I'm going to say, surgeons, I love you. But unfortunately or fortunately, we don't need these orthopedic surgeries much anymore. Meniscal tears in the knee can be healed with regenerative medicine, platelets and stem cells, rotator cuff tears, all of these kinds of things. I push people away from these surgeries, neck surgeries, back surgeries. Most of the time we can heal instead of doing these surgeries. So be very careful. See a regenerative medicine doc before you have a surgery and see if you can save yourself from an invasive surgery. So I have a question here. This says hip. So let's see what this person says. I just heard you on the radio and thought I should contact you about my problem. I'm having trouble with my left hip, looking for something other than surgery. Yay. I'm limited to how far I can walk before it becomes painful. Interested in what you can do for this. Well, the thing we can do for it, the person, knowing that the person can walk for a while means they have some range of motion in that hip. There may be some arthritis. But here's the important thing. Yeah, we can grow some cartilage back in that hip, but the person may not be having any problem with their hip. Sounds weird, right?
Right. It does.
I'm going to tell a story about a guy that just came in a week ago. He came in with hip pain, right? And he was in terrible pain. He came in on crutches. Every time he'd move, he'd scream. And I said, may I touch it? So the first thing I did is I touched around the greater trochanter. That's the side of the femur. It's close to the hip joint, but it's not the hip. And bingo, he screamed. I said, you probably have a tear in the muscle that attaches to the greater trochanter, which is the gluteus medius right there. So we got a x-ray. I didn't want to treat him. I'm not an x-ray, I got an MRI. I didn't want to treat until I knew what was going on. And I used my ultrasound also. I saw the tear, and we injected it. Within a couple of days, I don't remember the exact percentage, but I think he was about 90% better. And these are the kind of things we have to be careful of. We have to treat the right area. Just because we think hip and we think joint doesn't mean we get a surgery. We use our hands. Way too many people have had a surgery because the doctor never touched them. They thought it was the joint, or they thought it was this, or thought it was that. They never touched them. They slapped an MRI or an X-ray up and said, look, you've got arthritis. We need to replace that joint. And then they get the surgery and they don't get better. So we have to be very, very careful. Now, in this particular person who wrote this email, I wrote back, and then they wrote another email that says, as far as motion goes, I have full range of motion. So that's great news. It's when I put weight on my hip walking upstairs that is painful. I've not been to any doctors for this yet. Thanks for the info. We'll be checking you out. Whoops.
Oh, pause right there, please, Dr. Darrow. And our phone number for your calls is 866-870-5752 here at the station. We're going to take a quick break here on Living Pain Free with Dr. Marc Darrow. I'm your host, Nita Valens. We'll be right back.
You're listening to Living Pain Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, Call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned. Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at JointRehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls here at the station at 866-870-5752 so you can speak directly with Dr. Darrow. The website is www.lastemcells.com. That's lastemcells.com. If you'd like to just call the office and make an appointment or get more detailed info, personal to yourself, that number is 800-300-9300. And when you call the program today, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy. Would you like to pick up Joseph in Alhambra?
Joseph, Dr. Marc Darrow, how are you today? Your mom's knees are bothering her. What's going on?
Yes, let me get my phone on. Okay, I'm so sorry. My mom, she's 85 now, and the last time we checked with Kaiser, they took the MRI and said that both her knees are bone on bone.
Okay.
I'm wondering if there's
anything we could do? Is she able to walk around at all?
Yeah. Well, very, very slowly. I think she's in pain, but
okay.
She may have lessened lately. I don't know what she did.
Okay. So let me explain something for you. Bone on bone doesn't mean a whole lot. All right? That's a term that's used. To me, it's facetiously used when a doctor doesn't know what to do and thinks that surgery is the only answer. Of course, on someone like your mom who's 85, they don't like doing surgery anyway, thank goodness, because of other possible comorbidities. But bone on bone means nothing to me. I see people that come in every single day and they go, I've got bone on bone. I've seen several orthopedic surgeons over the years. They all say I need surgery, knee replacements, blah, blah, blah. And we usually get them... Joseph, do you mind if I finish up? Joseph,
okay,
can
okay. I thought you did.
Yeah, thanks. Okay. No, I'm still talking. Sorry. I'll give you a chance. So we generally will use, if someone has advanced arthritis, we're generally going to use platelets and stem cells mixed together, and it usually will take a few treatments to make them feel better. It's not going to give them a brand new knee, but it certainly can make people much happier and get rid of a lot of pain. So with someone like your mom, we would be thinking of doing that if that is the case. But I see a lot of people who supposedly have bone on bone, and I examine their knee and I start laughing because their knees are great. So I don't know where doctors get this concept of bone on bone from. It's a terrible thing. And in a sense, it brands the patient with a thought that their whatever joint it is, you're going to have bone on bone in your finger, or your shoulder, elbow, whatever. But it brands them with this thought that they're ruined for life and they need to get surgery or a joint replacement. And most of the time, it just isn't true. Okay? So in 1 second, I could tell your mom, I'd have to examine her, touch the knees and find out what's going on and see if she's a candidate for this. In most cases, people are candidates for regenerative medicine, even if it's pretty advanced arthritis. We have a lot of cases of very advanced arthritis where people get a lot better. Okay? Now it's your turn. Go for it.
I'm sorry?
Go ahead, ask questions.
Oh, okay. The other one is myself. My left knee was through a basketball injury. I stepped on somebody's foot coming down a rebound when I was like in my late teens or early 20s. I forgot. It's been that long.
Okay.
It was a loud crack, and then My team trainer says that you could deal with the pain, don't do anything, don't cut it up like that because it will leave like a 6-inch scar or 8-inch scar.
Yeah.
So anyway,
what has your doctor said about it now?
Well, I haven't seen the doctor.
Okay.
Then. It took a little while to heal, but it healed.
Okay.
Right now I don't have full extension. I think. I don't even know what broke. Was it a ligament or was it?
Well, I don't know. I'd have to examine you and see what's going on here. But lacking the full extension, there's an exercise you can do when you're sitting around watching TV or laying in bed. Put something underneath your heel and extend your leg and let gravity push your knee down. So it's a very gentle process, and that may help you get your leg straight again. But I would have to touch it and see what's going on, see how the range of motion is, and see if you have something called crepitus. Crepitus is the grinding. Well, the phone number to the office is 800-300-9300. And you can go to the website right now if you like. Well, you can call the office right now. There's people there.
I'm sorry?
Joseph, you crack me up, man.
The phone is lagging, so I'm sorry.
You're having phone trouble, huh, Joseph?
Well, it's lagging. I thought he was done, but he was not. And then I tried to talk, and then it lags.
Oh, maybe from the radio. Yeah. So listen, go to the website. Go to the website www.lastemcells.com, www.lastemcells.com, and you can watch me injecting a knee and see if it's something you think might be helpful for you. And I would love to see you. Okay. And I'd love to talk to you. And I appreciate your call. Thank you so much, Joseph. God bless you, and happy healing with your knee. I think there's good hope for you.
Thank you.
Take care. Bye.
So now we know what the issue is.
Yes,
it's the lag.
It's the lag.
Okay.
Our number is 866-870-5752 here at the station. You can call and speak directly with Dr. Darrow about your pain problems. If you're in back pain, knee pain, neck pain, arm pain, even carpal tunnel pain, tendonitis, stiff joints, dull aches, basically any kind of orthopedic pain, give us a call. The number is 866-870-5752.
Amazing. Let me take another question. How about that?
Good idea.
This one it's called cauda equina. Woo! Tough stuff, huh?
That's fancy.
It is. So let me see what the person says. The person says 2 discectomies and in pain. Cauda equina. So that's all they wrote. So I got a lot to talk about here. So cauda equina syndrome is when the tail of the spinal cord is typically impacted. It's being squeezed, and people often have what we call saddle anesthesia, like around the perineum, which is the sitting area. They have what we call saddle anesthesia, like the area where you would be riding a horse where the saddle would meet your body. And I don't know, this person doesn't, let me see if they responded to my email. No, they haven't responded yet, but I wrote them back. And I don't know if this cauda equina syndrome happened from the 2 discectomies. It sounds like it did, which is something that could happen. Because when you get a back surgery and you're taking discs out, that's pretty hairy surgery. That's not something I'd want to have done to me. And from my point of view, I'm just one guy, so don't burn me here. I don't find that people that have disc problems in terms of degenerative disc disease need to have surgery. It's generally a problem with the ligaments around that area that are stretched out. And it's called, what's your favorite word, Anita? Can you remember? Go for it.
Oh, something.
Yeah, go for it.
photosynthesis.
Yes, you're getting
Wait,
it. You're getting it.
I'm close.
It's called an enthesopathy.
Enthesopathy.
And it means where the ligaments or tendons or muscles attached to bone, it's irritable. It's sprained, really, is what it is. And it's something that regenerative medicine using platelets or stem cells heals most of the time. So just because you have disc issues, don't go jump and get a surgery. My goodness. And getting a discectomy, that means taking the disc out. Sometimes they put in fake discs, and I see people that do that with terrible problems afterwards. That's a really invasive thing to do. It seems like it should work really well. You just take out what's there and put and replace it, but it just doesn't seem to work too great. I know that they wouldn't keep doing it unless it worked on some people, but the ones that come to me are obviously the failures. And I'm going to take a chance here to say that probably half of the surgeries that are done are failures with orthopedics. Maybe not right in the beginning, but down the road. That seems to be what the studies show. And if you give us a call right now at 866-870-5752, 866-870-5752, I'm going to send you a copy of this book I'm holding up to the video camera that's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. I should say, please regenerate, please don't operate. Really? Because all these studies say don't do the surgeries. The results aren't that great. They can be amazing, but they can be terrible. And I'm not a gambler. I don't like Las Vegas. It's the last place on the planet that I ever want to go to. So, if you're a gambler and you love Las Vegas, go get a surgery. Take your chances. But I'm not that guy. Ouch. And it's not just because I feel that way. It's because I've been doing this work 22 years, and since the late 90s, and I don't see good results. I just don't. I mean, obviously the people with the failures come to me. People, if they had a great result, aren't going to come to me because they're happy. And there are a lot of people that are happy with their surgeries, but my clinic is filled with people where the surgeries failed. And the good thing is about using platelets and stem cells, most of the time, if you had a failed surgery, we can help you. If you've got a non-biological joint replacement where the prosthesis is metal or plastic, obviously injecting them with your platelets or stem cells isn't going to do any good. So be careful. Be careful, be careful, be careful.
Well, we have another Joseph calling in from Glendale.
Hey, Joseph, Dr. Marc Darrow, I understand you've got a torn rotator cuff and knee degeneration. Tell us what's going on. Hello.
Yeah, I have 3 problems. I'm 68.
Is that problem is that problem number 1?
Yeah. Problem number 1, torn rotator cuff in my right shoulder.
Yeah.
Since I was playing baseball.
Okay.
I've lived with it my whole life.
Okay.
Well, I now have torn rotator cuff number 2 in the left shoulder.
But guess what? Guess what, my friend? I have torn rotator cuffs too, and I have no pain. So what's the difference between you and me?
I don't know.
I treated mine. I self-injected them.
Well, that's why I'm calling. I want the right treatment. I don't want an operation. I'm not an operation kind of guy.
Well, me neither. I took that path one time, and it failed on me, and I'm not going there again, I hope. I'm knocking on my desk. It's wood. I'm knocking on wood.
And my number 2 is my knees. My right knee first, and my left knee is going to. I can't run anymore, so I took up biking, and it's still really hard on my knees.
Okay.
I need to do something besides those cortisone shots that only last.
Well, cortisone's the worst thing you can do. You know that.
I know. So I only do it when it gets really, really bad.
It's still the worst thing you can do when it gets really, really bad.
But I haven't had any other options until
Yes,
I
you do.
About your stuff.
Well, yeah, this is an option. But look up cortisone side effects on Google. I'm not making this stuff up. It destroys the tissue. You don't want to do it again.
Okay.
I know you won the battle, but you're going to lose the war eventually. Because in the short term, it feels amazing. There's nothing like getting a cortisone shot. You get the shot, and people in 2 seconds go, hey, I feel great. That's the lidocaine part of it.
If I can run again, I can keep my weight under better control.
Well, that's a whole other issue that we'll talk about when you come in. I'm going to give you the office number, and I'd love to see you. It's 800-300.
The third thing I have is, I've been in construction my whole life. I'm actually very healthy, very fit. But about 5 years ago, 6 years ago, I dropped a beam on my toe.
Okay.
And I smashed it.
Let me just say one thing, okay?
Toe of my right foot, and it is smashed, and it's been that way ever since. But it's gotten better, but it's still a thing where I can wake up in the middle of the night, and it's like some kind of weird shooting pain coming through it.
Okay.
Kind of like when I'm laying on my side in my sleep, and my rotator cuff decides to start shooting pain.
Well, Joseph, you're a wreck, but I think we can help you. Look, the phone number to the office is 800-300-9300. Okay, write it down. Come on and see me.
Okay.
Call there now. There's people waiting for you. Let's go to Richie.
Okay.
God bless you, Joseph. We love you.
Thank you, Joseph. Appreciate your call. Richie in L.A.
Hi, how you doing?
We're living it up, man. How about you? Yeah, I hear you great.
Oh, totally. I taught physical education for 7 years. I run around all the time.
Good.
So, of course, in having that fun, I've damaged right shoulder, torn some muscles and stuff like that. My right knee, I rollerblade, and
Yes.
I felt like I put weight a little bit too strong on the right knee, and
Okay.
it almost felt like something compressed.
Okay.
And the pain comes and goes. I've been listening to you for a long time, so I'm very much into
Thank
what
you.
you do. Yeah, operations is like not me, honey. What is there any nutrition besides the stem cells and the PRP and all this that can help tissue? Because I had a muscle actually disconnect from my right knee, and
Okay.
it slowly curled up into a ball. I think it was on one of your shows. You were talking to some guy who was like working out with his arms, and the muscle disconnected, and it turned
Yeah, I mean
into a bubble on
it's
his right.
common. Those are common things that happen. And yours,
Right. Is there
was it your quadricep muscle that did that?
Well, it's on the left side of the thigh, and it goes
Uh-huh.
from the, I guess, hip area down to the left side of the knee. And
Okay.
I've got a nice little ball up by my groin of the muscle where it curled up. Now, it's been a while. It's been many years, and you wouldn't think that I had it the way I run around and skate.
Okay, so it's not
is
something that's
like that
brand new.
repairable?
Well, I don't know that you need that repaired. I mean, you
Okay.
said it's been years,
Okay.
so I don't know that you need that
many.
repaired. Yeah, I mean, if you had, let's say, your quadriceps tendon rip off your patella, and you had a giant lump there, I would say get that operated on immediately. But I'd have to see what you're talking about. It may be the adductor muscle, which may have a little teeny lump on it. It doesn't sound like it's a terrible thing. And in that case, you wouldn't need to do a surgery. If it's painful, we could inject it and help that grow back a little bit. Yeah, not a problem. We can fix little tears. We can't fix giant tears.
If you have an old injury like that, is it possible to get it fixed?
Yes, it is.
Or is it really? Okay, something
Yeah.
to put in the back of my head here. But I'm going to come see you one of these days because another thing, this is going to sound weird, is do you have a program where somebody who's not a doctor can learn to do PRP and regenerative medicine, or you need to be a doctor?
Well, in California, you need to be an MD or a DO to be injecting. Obviously, nurses can inject, and nurse practitioners and other what we call mid-level practitioners. The problem is the standard of care. So if they were sued, they would lose, because it should be, when you're doing regenerative medicine, I'm going to put the word should up there, it should be someone with a medical license, because that's what this part of the country does. Malpractice has to do with the standard of care where you live. So if you're in a town with 5 people and you're a nurse, you could get away with this. You can get away with delivering a baby. If you're in LA, a big population center, you don't meet the standard of care, and a lot of the malpractice cases. I wouldn't do that for this kind of work. This is very complex work, and the malpractice cases that I see are with nurses doing these shots for chiropractors. The chiropractor has a big meeting, they buy dinners, and then people come in, then they have a nurse come in once in a while and do the shots, and the results are awful. That doesn't mean that a nurse couldn't learn how to do it. It's just that it's not the standard of care. And, it's a general maxim I have. When people come to me for a referral, let's say for a cardiologist or for a rheumatologist, I always tell them, go to the guy or the woman who does the most of it. Don't go to someone who does it once in a while. So if you have somebody doing it,
total sense.
Yeah, so you want someone who does this for a living, who does it all day long. I tell people when they go see a doctor for a procedure, ask the doctor, how many times have you done this already today? Not how many did you do last month, or how many have you done?
I know when I come, I'll probably be paying from my own pocket, because I don't think my insurance covers this type of thing. It's usually anything that is regenerative or preventative. The insurance companies don't seem to like to cover it.
You hit the nail on the head. And the reason for that is they're experts in orthopedics, are orthopedic surgeons and neurosurgeons. And that's who they're going to listen to. And I'm sorry it's like that, but that's the way it is. And that's what we have to live with today. I'm sorry.
Beautiful.
I'm just the messenger. Richie, I'd love to meet you. Sound like a really cool guy, and we'll have some good laughs together.
It's going to happen. It's a little bit up the road. I got to get a couple of shekels together. But, and I'll have a list of questions we can have fun with.
Absolutely. And I'll tell you what, once the restaurants open up, I'll take you out to dinner. Come in late, come in as the last appointment, and I'll use my shekels to buy you dinner.
He doesn't even take me to dinner, Richie. That's big.
I feel
my wife would get mad at me, Nita.
She could come with us.
God bless you, Richie, and thank you so much, Nita Valens. You're an amazing host. Thank you, everybody at the studio, and God bless all you listeners. Thank you so much.
Thank you, Dr. Darrow. Thank you, Alex and Suzette. Grab a pen or a pencil. Write down this information coming your way. Remember to listen to The Pet Show with our pal Warren Eckstein from 11 to 1 every Saturday. I'm Nita Valens, and we'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.